factor that leads to the trauma of domestic violence is mental health.
Yes.
And to discuss how we can begin to heal as a community, I'm proud to introduce the medical director of la Asociacion de Puertorriquenos en la Marcha, el Dr. Hector Colon Rivera. So he's joining us virtually, hopefully now. Yes, here you
There
are.
he is.
¿Cómo estás?
You and your organization. So thank you for the work you're doing. That's great.
Thank you so much. Thank you for that.
Excellent. So what are some like red flags that people could see when they're going into a relationship that isn't healthy? Because a lot of times, like, there's a lot of things that have been normalized in maybe in songs and movies that are actually red flags. And we need to recognize those red flags so that we could protect our mental health. So what are 2 or 3?
And you mentioned a few of them. I think behavioral changes, right? I mean, he's acting or she's acting in a way, and then that change, making promises that they cannot complete or follow up, change in mood, anger, substance use is another one, right? He was not drinking and now he's drinking, or she's drinking now, or using other drugs. So those are the risk factors. And remember, I think prevention education is key. We don't teach our kids, we don't teach our families how to deal with this or how to prevent things like that.
This is definitely a subject that's really difficult for a lot of people. So I'm sure that you come in contact with so many different people on a daily basis. What gave you the passion to want to work with this specific clientele in mental health? What brought you to
mental
this?
health? Mental health should be a priority. I mean, it's one of those things that people don't look for help, especially in the Latino community. They don't look for help until it's too late.
Absolutely.
So, being there, improving access, meet the patient or the person where they are, right? Don't wait for them to come to them. Educating, preventing, giving talks on high schools, elementary school about the mental health was important, right? We want to keep mental health a priority before it even become a diagnosis or a disorder. So that's what we want to do.
Right, absolutely. Starting young is super important. So I'm glad that you said speaking in schools, because our children learn right from the beginning, right from wrong, what's respect and what's not respect. So that's great.
Absolutely. And lastly, I want to ask you one last question. How is a victim affected? Like, how is their mental health affected when they are in a domestic violence relationship or when they're leaving? Like, what are some of the effects? Like, does it cause depression or anxiety? Like, what could cause?
Yeah, I mean, we talk about acute and chronic presentations, right? Changes in behavior is important. Not sleeping, not eating, feeling pressure, feeling tense, changing or stopping to see family or stopping to see friends that she or he used to be, right? Because also males suffering from domestic violence at home, so we want to also include them. But it's that. I mean, yes, we can see it as a diagnosis, we can see it as depression, we can see it as an acute traumatic disorder, or what they call PTSD, which is a post-traumatic stress disorder. We see it in generations, right? Mothers suffer from it, now the kids suffer from it because, they see the behavior and they copy the behavior from mom or dad, and they're victims themselves. So we need to break that pattern and look for help. Talk to friends, talk to family, talk to your kid, educate yourself. It's a lot of fear around the topic, and we are super afraid of talking about it. So that I'm a fan of organizations like Christina's, because that's what they do. They want to decrease the fear, and the stigma is huge in our community.
Mil gracias, Dr. Hector Colon Rivera. We appreciate all the information you shared with us today.